Hello and welcome. Today we're going to break down a really common prescription medication, Meloxicam. Whether you've been prescribed it yourself or you're just curious, we're going to get into what it is, how it works, and what you absolutely need to know.
So if you're one of the millions of people who's dealing with the daily grinding pain and stiffness of arthritis, you know just how much it can mess with your life. It's a constant battle, for sure.
And to help fight that battle, your doctor might have put you on a medication called Meloxicam. But what is it? I mean, beyond just being a pill you take, what is it actually doing inside your body? And what do you really need to be aware of? Let's dive in.
All right, first up, let's nail down exactly what Meloxicam is and what it's actually designed to do. The best way to think about it is like a very specific tool for a very specific job.
Okay, so Meloxicam belongs to this huge family of drugs that I guarantee you've heard of, NSAIDs. That stands for Non-Steroidal Anti-Inflammatory Drugs. This family includes stuff you can buy right off the shelf, like ibuprofen and naproxen. The difference is, Meloxicam is prescription only. Its main job is to go after pain, knock down swelling, and ease that awful stiffness in our joints and muscles. So what kind of conditions is it officially approved for? Well, the big ones are all different types of arthritis. It's used for osteoarthritis, that's the common wear and tear kind, and also rheumatoid arthritis, which is an autoimmune condition. It's even used for juvenile rheumatoid arthritis in kids who are 2 years old and up. A really common starting dose is just 7.5 milligrams, and you just take it once a day. Now that once-a-day convenience is possible because Meloxicam has what's called a long half-life. All that really means is it stays active in your body for a much longer time than other pain relievers.
So how does one little pill do all that? To get that, we need to peek under the hood and see how it actually targets the source of inflammation deep inside our bodies.
Okay, so inside all of us, we have these two really important enzymes, COX-1 and COX-2. Just think of COX-1 as the housekeeper. It's doing good things all the time, like creating stuff that protects our stomach lining and helps our kidneys work right. COX-2, on the other hand, that's the inflammatory one. It's the one that rushes to the scene of an injury and starts pumping out the things that cause pain, swelling, and fever.
So here's the crucial part, Meloxicam's whole strategy. It's designed to be what they call a preferential COX-2 inhibitor. This means its main goal is to block the bad guy, COX-2, way more than it blocks the good guy, the housekeeper, COX-1. The whole idea behind this design was to get all the awesome pain-relieving benefits, but with fewer of the nasty stomach side effects you'd see with older NSAIDs that just block both enzymes equally.
And now, we need to talk about the most critical part of this entire conversation. I'm going to shift my tone here because it is absolutely vital to understand the serious warnings that come with Meloxicam, just like they do with all other NSAIDs.
This is not a small thing. Meloxicam carries what's called a black box warning from the FDA. This is the most serious safety alert the agency can put on a medication, and they only use it for drugs that have potentially life-threatening risks.
The black box warning points to three major areas of concern. First is cardiovascular risk. These drugs can increase your risk of a heart attack or a stroke, and those can be fatal. Second is gastrointestinal risk. They can cause really serious stomach problems like ulcers, bleeding, or even a hole in your stomach wall, and sometimes with zero warning signs. And third, there's kidney risk. Using them long-term can lead to serious kidney damage.
Okay, so beyond those most severe warnings, there are also some other common side effects and really important drug interactions that you've got to be aware of if you're going to use this medication safely.
A lot of people might experience the more common, milder side effects. We're talking about things like indigestion or feeling nauseous, getting headaches, some fluid retention that might cause swelling in your legs, and sometimes a skin rash. This right here is why telling your doctor about everything you take is so important. For instance, mixing Meloxicam with other NSAIDs like ibuprofen massively increases your risk of stomach bleeding. If you combine it with blood thinners like warfarin, you're looking at a risk of life-threatening bleeding. Even common antidepressants and blood pressure meds can have dangerous interactions. Okay, I get it. After hearing all of that, you might be feeling a little bit on edge. But knowledge is power, right? So let's turn all this information into a practical safety manual for how to approach this medication in a responsible way.
If you remember only one thing from this whole explainer, please let it be this. The cardinal rule for taking any NSAID, and that includes Meloxicam, is super simple. Use the absolute lowest dose that works for you for the shortest amount of time possible. That is the single best way to lower all the risks we've just talked about.
Now, there are also some people who just should not take meloxicam at all, period. This includes anyone who has a known allergy to other NSAIDs like aspirin. It also includes patients who are about to have or have just had heart bypass surgery, and it's a no-go for women in their third trimester of pregnancy.
So what are the key takeaways for you, the patient? First, be an open book with your doctor. Tell them your entire medical history. Second, limit alcohol, because that also raises your risk of stomach bleeding. And finally, just be vigilant. Know the warning signs, like black tarry stools for bleeding or chest pain for heart trouble, and get help immediately if they show up. So here's the bottom line. Meloxicam can be a powerful and effective tool against inflammatory pain. It can dramatically improve the quality of life for a lot of people, but that power comes with very serious risks that absolutely demand respect and careful management. Ultimately, that question, whether the benefits are worth the risks for you, that is a critical conversation you need to have with your healthcare provider. Thanks for joining us for this explainer.